Hello.
Smile.
A big cry.
Are you enjoying yourself?
When we first discovered that Banana SMA, we were told that there was no treatment or cure. That was a couple of years ago. We went online, we found a lot of information, but here's the challenge, right? With so much information, we tried to then look for people in Malaysia, the doctors or the therapists or families who could guide us as to what needed to be done. Then we wanted to reach families to find out how they coped in Malaysia. Even that was really difficult. 1 to 2 babies are born with SMA every week in Malaysia. 1 in 50 people are actually carriers of the SMA gene.
We set up WeCare Journey so that other families who have the same experience like us can get more support and more information on how to take care of children with SMA in Malaysia. What we want to tell other families with SMA is the journey will not be easy, there may be challenges. However, do not give up. There is hope.
It's a difficult journey, but your child also will surprise you, right? With their resilience, with their courage, with their abilities in different ways. And what it's taught us is that whilst SMA is a progressive disease, right? We don't count the days. I think what our children teach us is to make the days count.
WeCare Journey embraces diversity, and we strive to foster inclusion in everything we do. I've had the privilege to meet many families with SMA, rare diseases, and other disabilities. Now, we are all not the same, but we believe that with faith, hope, and love, everyone can have the chance to be the best that we can be, regardless of the limitations that we're born with and regardless of the limitations that we face.
Can I encourage all of you to go out and give whatever support you can to every organization out there. There are so many that needs help. I think we have to stop doing programs, OKU and non-OKU programs. I think integration is key for us because they are one of us. you, before you go back today, make the effort to go up and talk to one of the families of these children. Go up to them, introduce yourself, and try to stay connected and see how you can support them in the long run. I think effort like that will go a long way to encourage the fathers and the mothers.
Brendan. Hello, my name is Jaden, and this is my brother's story. He was diagnosed with spinal muscular atrophy when he was just 1 year old. But I don't know what that means. The doctors told my parents that he would have difficulty moving, eating, and breathing. They told my parents he would not live past 2 years old. But my parents never stopped fighting for him. My parents loved us, cared for us, and watched over us. Brandon made many friends, and I made many happy memories. Every week, one baby is born with SMA in Malaysia. We Care Journey supports families affected with SMA. Today, there are 2 drug therapies that can stop this disease. To families affected, these treatments are a second chance. I know it is hard for my family, but knowing that they are not alone means that there is hope. And while there is hope, we will keep supporting one another.
I got a second chance to have a happy life.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to all. Those images certainly remind us of better days, and certainly we long for them. Welcome to this morning's webinar, Stepping Up for SMA, which is the first in a series of webinars on spinal muscular atrophy, or SMA, co-organized by We Care Journey and the Galen Center for Health and Social Policy, with the support of Biogen, Novartis, and Roche. Ladies and gentlemen, please find the agenda for this morning sent to you via the link provided in the chat box below, which will be shared to you by my colleagues shortly. Please do take a look at the agenda and to be able to follow the discussions ahead. This session this morning is being live streamed through the Facebook page of We Care Journey and the Galen Center for Health and Social Policy. So before we begin the program, I thought we could start a little bit of a poll for us to have a look and see where we are in terms of some of the popular foods that people would like to have. So in this case, I would like to just ask you all, in terms of food, what do you like, and what perhaps did you have this morning? You can choose how many you like, and I can see there nasi lemak seems to be quite popular there, and roti canai. Oh, okay, some very unhealthy foods there, but all right. Okay, we're seeing more and more people there participating. We have with us right now around 62 participating individuals, and we'll be able to see more as we go on. Have we stopped polling? Okay, so let's just see there. In terms of the results, ladies and gentlemen, we can see that nasi lemak around 74%, and another 62% roti canai, and followed by our favorites, pisang goreng, of course, teh tarik in the morning, and teh ais, kopok leko as well. Excellent. So, ladies and gentlemen, I would like to just thank all of you for attending this morning's webinar. And before we begin, I would like to just indicate to all of you that this morning's session is being recorded, and therefore will be made available for all, both on FB Live and also through our records. So, ladies and gentlemen, I would like to just draw your attention, as many of us here this morning are aware, August is Spinal Muscular Atrophy Awareness Month. Though the COVID-19 crisis continues to dominate almost every aspect of our lives, we are reminded that neither life nor other issues or concerns take a pause or take a back seat while we deal with this pandemic. It is estimated that 700,000 Malaysians are carriers for the gene mutation which causes SMA, and 1 child is born every week with SMA. And despite immense adversity and numerous challenges, today, because of the dedication, commitment of parents, caregivers, and with new treatment available, there are children, teens, and adults with SMA who are living productive and fulfilling lives, inspiring and bringing us hope with their example. To begin this morning's program, let's hear from the co-founder and president of Persatuan We Care Journey, Edmund Lim. He, Yap Suk Yi, his wife, and their 10-year-old son, Brandon, have been fierce and passionate advocates on the issue of SMA. It has been a journey for them ever since Brandon was diagnosed with SMA in 2011. Faced with many unmet needs in care and support, We Care Journey aims to change this reality. We Care Journey provides support to families with SMA, creates awareness, responsibility to take action, and empowers families to lead hopeful lives. It is, as the name of the organization again suggests, a personal journey, which has resulted in providing inspiration and motivation for many others in Malaysia who are with SMA and caring for others who live with the condition. So let's hear it from him. Over to you, Edmund. Go ahead, sir.
Hi, thanks, Azrul. Good morning to you. Good morning to everyone here. I'm privileged to be given a chance to speak to so many of you here from all around Malaysia, and I see also from Singapore. So, for all of you where you're dialing in from, do get onto the chat and just let us know where you're dialing in from. As Azrul has explained, I'm the father of a child with spinal muscular atrophy. I'm not going to try to explain to you all the medical stuff because we've got two experts following me who will be able to really describe to you, what SMA is from a more medical healthcare perspective. But as a father, what I want to do is to give you just firstly a sense of what SMA is, so that you understand what is SMA. And then the other topic I'm going to talk about is, why I think it matters to you. So what is SMA? Imagine for all of us here today, we're sitting somewhere, we're sitting down, maybe some of you are standing up watching this. We're able to, sit up, stand, walk around. That's because we've got all the muscles that we have. Like, I can move my hands because I can control all of my muscles. But if you can start to imagine, if you only had half that strength, what's that going to be like? If you only had maybe 10% of your strength, 10% of the strength that you have today, what is that life going to be like? Essentially, that's what SMA is, right? So every patient with SMA does not have the strength that a typical person have. They only have a fraction of it. So the question I have then for you is like, think about if you only have a fraction of the strength that you have today, what would it be like for you? It's not going to be easy to talk because you need a lot of muscles to talk, to eat and chew. You need muscles as well to eat and chew. And one of the most important life-giving things is obviously to breathe, to be able to take a deep breath. Even that's impacted for a patient with SMA, right? I can take a deep breath, you can take a deep breath, but for many of them, they can't. They can breathe, and at some point, the breathing even stops in the sense that they can't have the ability to breathe by themselves and need to go on a ventilator. So that's the impact of SMA and, and what it does to a patient. What does that do then to the daily living? There's a whole, side of it, which is all healthcare. A patient with SMA needs 10, 12, sometimes up to 15 different medical professionals. And I do mean different. So we need to see everyone from an orthopedic to a neurologist, who's like Dr. Purani, who's going to be speaking later, genetic counselors, who's Susanna, who will be speaking later, and many, many others. So, but, I'm going to leave that aside, but I'm going to try to relate what living with SMA is from the point which Azrul raises now, which is, everything seems to be dominated by COVID today. So I guess, life with COVID today, what does that involve? Right, masking, staying home, keeping hands clean and, hygiene, sanitizing, all that's really important. And that actually is a life that we started to live as a family with SMA from the moment Brandon was born. And it's the same for all other families with SMA. The reason being, just like COVID, is that if he catches an infection, there's a high chance of him ending up in hospital, right? And that's because, remember I mentioned about breathing. So his muscles aren't strong, which means just a normal cough and cold or the flu. So leave aside COVID, right? Leave aside COVID. Just a normal cough and cold that we always used to get, and we still get. He runs a risk, and all the other patients the same, runs a risk of ending up in hospital because he's not able to cough it up. He doesn't have the strength. So that then leads to increased congestion of the lungs, and that leads to pneumonia. So I think if you sort of imagine that being our life, that looks very much like COVID, right? The situation we're all facing today, the fear of getting ill and the fear of getting ill and what it could lead to is actually the nightmare that, you know, every family with SMA faces from the moment they know and discover that they've had SMA. And before they've discovered they've had SMA, it's the same problem that would have been facing, but they didn't know why, which is a cough and cold comes. Before you know it, we're rushing to the hospital. Before we know it, you know, for Brandon, you know, I've lost count a number of times that he's been in hospital, but he's been in hospital like a Cat 3, Cat 4, definitely. Hasn't been a Cat 5. So Cat 5 is ventilated support, but many other kids have been hospitalized many times requiring ventilation support. So the life and the impact of SMA and the burden of SMA is something that we will struggle to explain to people years ago, but it's something that today, because of COVID, I think everyone sort of gets it, because it's exactly what we're all facing now, right? The flu, a fever, quickly becomes something that we can't resolve in the house, ends up in hospital, everything from Cat 3, Cat 4 to Cat 5 situations. Now, that being that burden and that life, you can imagine what it's like for a family with SMA. So imagine how difficult it is coping today, how fearful you are of getting ill. That's something that we've lived with, you know, from 10 years ago when Brandon was born, and something that we're going to live with, you know, moving forward. You add on all the other medical concerns and everything we need to do. I'm just trying to, you know, explain to you that the burden of SMA is immense, right? The stress is immense. What it takes out from all of us, as in the families, in terms of whether it's psychological, economic, medical concerns, you know, it is immense. That leads me to, why is that important? Why does it matter then? So you would think, well, okay, you don't have SMA, you're not impacted, which is true. But then again, I'm going to ask you, Azrul mentioned earlier when they started about 700,000 people who are carriers of SMA. If you look at the statistics for COVID today, we've got hitting 1.2, way past 1.2, I think, hitting 1.3 million carriers, in a sense, carriers, people who've been infected either symptomatically or asymptomatically. So you think about SMA, it's half of that. It's close to about 700,000 people are carriers of SMA, but asymptomatic carriers. That means like me, I'm a carrier of SMA. I didn't know. I don't exhibit any of the symptoms of SMA. Neither does my wife, So she's a carrier of SMA, but she doesn't know, she doesn't exhibit any symptoms of SMA as well. And that's the risk, because the 700,000 other Malaysians who are like us, who don't know. And what happens is, if you are a carrier and you marry someone else who's a carrier, you always have a chance that you're going to have a child who's going to be born affected by SMA. And when you're affected by SMA, it's a tremendous burden that I've tried to, you know, explain to you earlier, that you're going to face as a family. So that's why we think it's important for everyone to have greater awareness and knowledge about SMA. Because one of the things about SMA is, unlike COVID, COVID is infectious. So I can get it from someone else, and you can infect someone else. So I'm as a carrier of SMA, or my son who's affected by SMA, we can't give it to anyone, right? So SMA is not infectious, it's inherited. Because it's inherited, though, there's certain things which are, there's certain things that you can do to then prevent it, right? It's not just about SOPs, right? That's, you know, something else. But because if you know you're a carrier, there are ways now that you can avoid having a child with SMA. And if your friends know, let's say you're not planning to have a family, and if you can share this with your friends will also be able to know more, to do something about avoiding the risk of having a child with SMA. And it comes down to greater awareness. Now, with these, the other thing that's important between COVID, you know, and SMA is today, when Brandon was born, it was very little that we could do around treating the disease itself, right? There's a lot that we had to do around managing the symptoms. But, you know, in the last 10 years, a lot has changed. Science has moved ahead a lot. There's a lot that can change now in the life of a child with SMA, which is completely transformative. So children in the past who weren't able to even get out of bed or sit up by themselves, you know, if things were done right and they got available and they got access to certain treatments and then manage the condition really well, they could be walking as well. So a lot has really changed. And that's the other important message around being able to prevent. And if there's children with SMA, patients with SMA, there's a lot that can change now that wasn't available 10 years ago. Now, my time is up. I'm really excited to sort of hear from Dr. Purani and Susanna after this. So I'm gonna hand it over to them. I hope I've given you a quick overview on what is SMA from a layman sort of perspective. I hope I sort of conveyed to you why I believe it's important for more people like you to know more about SMA, because then there's a lot of informed choices, a lot of things you can do. Just attending today, I think you've made already a big difference at taking the time out to understand what this is. It may come up later in your lives, and it may come up in your professional careers or your loved ones, that when you share something, you help to either prevent an incident of SMA or be able to help someone diagnose it quickly so that they can get the right care and support earlier and get better outcomes in their life. So I thank you. My time's up. So what I'm going to do is pass it back to Azrul for the next speaker. Thank you again. And it's a privilege to be able to talk to you today. Over to you, Azrul.
Thank you, Edmund. Thank you so much for those insightful the experience that you've had and the passion that you bring to the issue. Honestly, Edmund, we're so glad that SMA in this country has a champion and you, Suk Yi and Brendan, in wanting to make sure that the lives of people and families with SMA change for the better, not just here in Malaysia, but also in this region. I'm astounded that this morning we have so many participating in the session here, also coming as far away as Hong Kong. So well done, We Care Journey, for being able to garner so much support in this. For our next speaker, we have with us Dr. Purani Anandan Krishnan, who joins us as a pediatric neurologist at Hospital Tunku Azizah, Kuala Lumpur. For the past 5 years, she has been looking after infants and children with neuromuscular conditions and disabilities. Early detection in some types of SMA can make an impact, and therefore it is something that is a requirement and definitely something that we would like to see happen more and more in the screening of infants and children with these conditions here in Malaysia. So, ladies and gentlemen, please, let's hear from Dr. Purani on how we can all play a part in detecting SMA early. After you, Doctor. Dr. Purani?
Yeah, hello, good morning.
Go ahead.
Thank you to the organizers for inviting me to kickstart this SMA awareness project. I don't see my slides, Azrul. Okay, so I have no disclosures to make. Outline of my presentation today. Oops. Slides and okay. So outline of the topics on my presentation today is what is SMA, spinal muscular atrophy, the inheritance pattern, types of SMA and its early signs or red flag signs. So SMA is a genetic disorder that affects the nerve cells in the spinal cord that controls the voluntary muscles movement, such as walking, breathing, and swallowing. The brain communicates with the body using the motor neurons, which transmit signals to the muscle. In this condition, motor neuron itself does not function properly because the muscles do not move, they get smaller or become atrophied. Incidence in Malaysia is 1 in 10,000, approximately 1 in 10,000 live births. So SMA is inherited in an autosomal recessive manner with both copies of the gene needed to be faulty for the condition to occur. And parents are usually both carriers, and meaning that they only carry one faulty gene, and they themselves do not have the condition. Faulty gene can be passed on to their children. And normally, most of the protein made from the survival motor neuron 1 gene is a full length in an unaffected patient. It's a full length functional protein. And you have a backup protein, which is SMN2. But when mutations occur, little or no full length SMN protein 1 is made, causing SMA. So you don't have any of this SMN1 protein, and you have a number of SMN2 protein copies, which will give you much less, which function much less efficiently and cause SMA. So we move on to the types of SMA. There are predominantly four major types. The type 1 usually presents in children less than 6 months of age, and these children are unable to sit up on their own. Type 2 is between, the age of onset is usually between 6 and 18 months of age. They are able to sit but not walk independently. And between type 3 and type 4 SMA, they occur a bit later in life or in adolescence to adulthood. And these children are usually able to walk, though they may lose their ability over time. So I move on to the common or early red flag signs which are seen, or if you notice your child to have them much earlier, present early to a medical facility. So the common complaints that we usually get is a child who is very floppy, very difficult to hold up, and seem to be slipping through your hands when you carry these babies. Some of them, when they present, they have delayed motor milestones. So it's important to look out for your child if they're able to reach out, they're starting to turn, able to roll over a little before being presented. So when we see these presentations, we are usually quite we become a little bit more cautious that these children are presenting with these delayed motor milestones. And some of them begin to have feeding issues. They're either choking or they have sucking difficulties and swallowing difficulties. For breathing problems, they usually have rapid shallow breaths and breathing from the stomach, which we call paradoxical breathing patterns. I like to show that. So this is when you take a deep breath, your chest and your abdomen expand. But for these children, it looks like a seesaw. That means as they expand the chest, the stomach goes down, and when the stomach expands, the chest goes down. So they're not able to take good deep breaths. And then you also have very slow leg movements. So you notice that this child, despite trying, he's not moving his legs very much. He's only moving his hands. And sometimes they're not able to lift it off the surface. And there's asymmetry between the movement of the upper limb and the lower limb. And this is a classic sign that we always look out for, especially in our type 1 SMEs, tongue fasciculation. So you can notice my patient here who has got a vibratory tremor-like movement of the tongue. Repeat the video again. You can see that there's a tremor-like movement of the tongue, and that's at resting position. So in conclusion, diagnosis of SMA is early. Early is very critical. Diagnosis in young children is often very delayed. And I hope that I've showed you features of red flag signs that you could pick up and bring them over for early detection, early identification, and then possibly treatment or management of this condition. So there's no cure, but newer treatments have the potential to alter the disease course and severity. Thank you. And I've also to thank my parents of these patients for sharing the photos and videos. Over to you, Azrul.
Thank you, Dr. Purani, and thank you so much for sharing us your insights into the expertise that you bring into the issue of SMA, and we're definitely glad that you are here with us to talk about these issues. I just also wanted to mention to everyone out there, I know many of you have burning questions that you want to ask Dr. Purani and Puan Suzana, and I would like to encourage you to please share your questions to the panelists through FB Live, or if you're with us on Zoom on the Q&A box that you have at the bottom of your screen. Please do send your questions over and we'll be able to get them answered by our colleagues here this morning. And we also will be sharing with you shortly the Slido link that you can also pose your questions through that particular platform. So with that, we go on to our next session where we will be exploring further into these issues. And we have with us Puan Suzana Abdul Hamid, who is the head of the Psychology and Counseling Unit at Hostel Wanita dan Kanak-Kanak Sabah. She is an EXCO member of Genetic Counselling Society of Malaysia and was attached previously to the genetic clinic at Hospital Kuala Lumpur. Some of you may be wondering what is genetic counseling and how can that be a form of support. So to help facilitate this morning's discussion with Puan Suzana, we also have with us our colleague from We Care Journey, who is a medical student attached with them, Cik Adlina, who will be helping us guide this discussion further on. So with that, I would like to hand it over to Puan Suzana and Adlina. Go ahead.
Hi everyone, wherever you are. Good morning.
Morning. It's nice to see you, Ms. Susanna.
Nice to see you too. Hi everyone. So yeah.
All right. So just to get things started, let me just introduce myself again. I'm Adina, recently graduated from medical school. Not a doctor yet, I haven't gone into HO, still waiting for placement. And Miss Susanna here is our esteemed genetic counselor. And she is with us today to talk about her perspective as a genetic counselor and what role do they play in SMA care. Would you care to elaborate on that?
All right. Thank you. Can you hear me?
Yes, perfect.
All right. First of all, we need to understand what genetic counseling is. Genetic counseling is the process of helping people understand and adapt to the medical, psychological, and familiar implications of genetic contributions to the disease. So where does genetic counselor fit in? So genetic counselors are healthcare professionals who are trained in medical genetics and psychosocial counseling. So actually, they work in partnership with clinical medical geneticists or other medical specialists like medical oncologists, neurologists, and maternal fetal medicine specialists, especially for prenatal diagnosis case. They work together in providing genetic counseling for patients and their families who are known or suspected to have a hereditary condition. So to support these affected with genetic conditions, genetic counselors help actually in translating empirical genetic knowledge to assist the clients understand and adapt to the diagnosis of genetic condition in the family, its implications, and make informed decisions. So genetic counselor that provides family-focused service that considers the effects of genetic condition on the whole family, not just the referred individuals, and provide support and appropriate resources to all who are interested. Yeah, that's the gist of it. If I can summarize why.
Okay. Yeah, I feel like there's a really big role because you're sort of a bridge between the families to all these clinical specialists that are involved in the SMA care.
Yeah, that's what we do actually. So the role here is first. I think I need to. It is worth mentioning because diagnosis was done by clinical geneticists. So as genetic counselors, we help clinical geneticists in reviewing patients' family and medical histories, explain how genetic conditions are passed down through families, figure out if patient or any of their family members are at risk of for certain disease, and find and give information to patients about genetic conditions, provide information about testing options, and help them decide what is best for an individual family. Yeah, yes, that's basically what we do, because we try to help patients, but genetic counselors, they don't work in silo. We need to understand that. Genetic counselors, they work together in a team, multidisciplinary team, together with clinical geneticists, the one that I explained before. So we need to understand where this service comes from. So it's genetic counseling is not a service that you can get from. It's not a widespread service. So even clinical geneticists, the first established service was in 1995. So that was
As old as I am.
yeah, that was 1995 in UMMC. So Prof. Tong was the spearhead of the service. And then we have subsequent trained genetic counselors first received the training from out of this country, and subsequently National University Malaysia, they have training for graduate students for genetic counseling.
Okay. Yeah. So basically, you're telling me that genetic counselors have their own training, specific training to talk about these issues. Okay. So now that we know what genetic counselors do, but how do we get to them? Like, where do I find you?
All right. Currently, we have it's centered in HKL. Currently, genetic counseling service we have in HKL Genetic Clinic, genetic clinic in Penang Hospital. We have in hospital UMMC, as I mentioned before, the first established genetic counseling services. We have UKMMC, Hospital Tunku Muhriz, formerly known as UKMMC, and we have HUSM, Hospital University Science Malaysia, and for private service we have from Loh Guan Lai Specialist Center and Cancer Research Malaysia, which specialize in cancer genetics, and we have Genetic Counseling Asia. But for Genetic Counseling Asia, we need a pre-scheduled appointment, and you can look it up in the internet and ask first before the appointment. Yeah,
That'll be definitely something that important for me to know in case I go into HO and then I have to contact you somehow. So I suppose that's how we work with the healthcare system. You go through the clinical geneticist, get the diagnosis, and then you'll be linked to a genetic counselor for the process of understanding.
Because genetic counselors are not medical doctors, except we need to have the diagnosis first, then we can provide support with relevant information to the patients, not only to the patients, but also to the family members.
Okay, perfect. Thank you so much. So now that we've gotten that background of what a genetic counselor does, how do they approach parents and families? Because that's the main people that we're looking into here. So how do you support them?
Okay, well, how do we support the best way to cope for patients and parents with genetic condition? How do we support them? It's easier said than done. Support is there, genetic counselor is there, but once you get the diagnosis, it's easier said than done, because it's easy for someone else to talk about the best way to cope with genetic condition. So first, this because the patient and parents who are themselves experiencing what they went through, parents seeing a child who is struggling with limitations. So to be informed that a child is affected with SMA for parents, and to know that a patient diagnosed with a rare condition, it is devastating news to process. So let us give ourselves some time to digest and process the news about our own or our child diagnosis and focus on our understanding of the condition. We know ourselves better than anyone else. It is normal to be shocked, sad, angry, and in denial upon receiving the news. But at this point of time, it is crucial to avoid blaming and finding fault between parents, because it is not helping the relationship and not going to change the diagnosis. So to find someone we trusted or professionals to talk about that diagnosis, what happened, our feelings, to help reduce the intensity of our mental, psychological, emotional, physical, and behavioral reactions to the news. So as a person with a genetic condition, we might want to focus on what we want and what is within our control, because focusing on things that is beyond our control might only cause us to feel inadequate and feeling uncomfortable in our own skin. This internal struggle actually needs to be addressed in order to save ourselves from falling into prolonged emotional burden and mental distress. But apart from our own coping skills, it is important, but support from society is also as equally important too, because awareness, social recognition, empathy, knowledge, understanding, acceptance in general public about genetic condition may help patients and family feel supported and become bearable in facing their life challenges. Yeah. So
And I feel that ties really well to what Edmund said in the beginning about making it more inclusive for people with SMA in these families. Yeah. And there's a lot, and from what you said as well, I feel like the word that we want to hear is empathy. You know, you just have to be kind and empathetic towards people and to understand where they're coming from.
Yeah. At least please make it bearable, because what they went through, and we just try to understand, and at least the least that we can do is help to understand and be aware of the condition, be aware of things surround us. Yeah.
On that point, I think, Ms. Susanna, you brought out a really good question for me to ponder upon. As you know, a medical graduate going into HO, like what should I do? What the expectations that you would have towards new medical students or medical graduates and new doctors for the future, or even the current ones as well?
Right. Just try to be aware of genetic things, because this genetic is not as, the service is not as widespread as ONGs, pediatrics, orthopedics, is there. So at least you are aware of the service and be the symptoms. Sometimes symptoms might be the same, and it might indicate certain condition, but you might need to dig deeper. So the answer might have with geneticists. The symptom is there. It might mimic certain condition, but when you give, it's never just. I think geneticists is just one call away. Us, they're just one call away, and you can just write referral, so that communication between professionals, even within healthcare itself, needs to be bridged, not only between genetic counselors, geneticists, and the public, but among ourselves, healthcare professionals. We still need to acknowledge, we still need to work together and be kind to each other. The understanding is there, communication needs to be there.
And I think with what you've shared, the exposure is not as much. I'll be honest, like SMA is not the top diagnosis I would think of, but now that you've mentioned, I feel like just because it's rare doesn't mean we don't need to care, like we do need. So thank you so much. I think those are most of our questions.
Yeah, can I just add in a little bit?
Yes,
when I start genetic counselor work with multidisciplinary team, we does not exclude, because laboratory research like molecular testing, lab specialists are very important. because you can't get diagnosis without result from lab specialists. So yeah, again, it's the multidisciplinary team effort and to help our patients. That's the key point, the need of our patients, genetic patients.
Everybody has a role in
Yeah,
patient
everybody has a
care.
Yeah.
All right. Thank you so much, Ms. Susanna. That was
All right.
amazing. I think we don't have any other questions to discuss.
Right.
I'll bring it up back to Azrul then.
Thank you. Thank you,
Thank
Dr.
you.
Alina and Mr. Azrul.
Thank you, Puan Susanna, and thank you so much, Adlina, for that session a moment ago. It has been quite enlightening. It actually brings me back to my undergraduate days, really, talking about genetics. Ladies and gentlemen, I would like to just remind you all that you are able to send your questions to us through the Q&A box on your Zoom application, as well as through FB Live. And of course, those who want to make use of the Slido application, you have on screen right now the link for the Slido app, as well as the necessary code to ask your questions. So please do make use of the opportunity to ask questions to our colleagues who are on this panel this morning. We already have quite a few questions, so I'm going to go straight into the discussion right now. So let me just put them back on. Dr. Purani, Puan Susanna. If you could activate your video, please, Puan Susanna. Okay. So we have a question each for Puan Susanna and Dr. Purani. So if I may ask the first question to Dr. Purani. So how much of a difference does 1 year make? Is there a critical window for diagnosis of SMA? Go ahead, Dr. Purani.
So this SMA, as I mentioned, has got different forms. It's based on the number of SMN2 copies. So the ones with very few copies, like 2 copies, they usually present very early. Sometimes the signs are not seen earlier on, so these red flags will make them pick it up and refer to appropriate centers, mainly the Klinik Kesihatan, through to the pediatrician or to our clinics. So those are important because once we see a patient with SMA, we need to decide which, and then once the genetic testing is done, we actually decide into which category we place them in and how we follow up management for these patients. And, sorry, I can't.
Sorry, and basically when you look at the diagnosis, can it actually be done at the hospital itself, or do you have to go to a specific hospital in order to get that diagnosis? And what would you advise parents?
Yeah, so first is getting the right diagnosis. So there are a lot of conditions that present with floppy babies, but with all the signs that I showed earlier, we do encourage them to go via a proper channel and get diagnosed, and then come to either main hospital where the bloods will be sent to the common lab, which is usually an IMR, and the genetic test is done there and then sent back to the treating doctor, either the main public hospital or to the muscle clinic.
Okay, so we're going to go back to some of those points that you raised earlier, but I'm going to go ask Puan Susanna on a question that was asked. How widely available are genetic counselors in Malaysia? You mentioned just now 1 call away. Is it really? You mentioned just now about genetic counseling first being set up back in UMMC, and that was back in, what, 97, you said. So how far have we progressed since then? Are really genetic counselors just 1 call away? Go ahead, Puan Susanna.
Okay, 1 caller is literally speaking. So in 1995, if I'm not mistaken, the first established genetic counseling services in UMMC by Prof. Tong. And in 2015, we only have like 4 genetic counselors in the whole Malaysia. So in 2019, we have like 7 or 10 genetic counselors who graduated from the National University of Malaysia and who came back from training from overseas. So yeah, to say the least, one call away. I mean, you can just Genetic Counseling Society Malaysia is there. You can just give them an email, and we might respond to that. And or to make it easier, maybe you can those who are interested might just have a call those the genetic clinics or the services available, and maybe ask if they can, because geneticists or genetic counselors not on the phone all the time, so they have their standard work responsibilities to do. They might just leave a message, and if they might come back to you, yeah, or just write a referral, yeah.
Well, obviously, there's contact points where we can actually get this information. I do hope you'll be able to share with us on the chat later on as to whether there are a link or phone numbers for us to be able to access. But Puan Suzana, there's also a question here from people who were very interested in what you were saying just now. I mean, what's a lab geneticist? What's the difference between a geneticist, normal geneticist, and lab geneticist? Go ahead.
Okay, right. Geneticist is a medical doctor who medical clinical geneticist who attend to patients who specialize in clinical manifestation, like seeing patients and diagnosis. But in order to get this diagnosis, there must be symptoms and criteria for diagnosis. But we still in genetic service, we still need lab scientists. We still need lab specialists, lab scientists, because they are the ones who are specialized in reading the technical lab report and can identify the mutations and make sure that there's no what you call the technical things in genetics. Yeah. So geneticist is the one who's seeing patient. Clinical geneticist is the one who, medical doctors who see patient. Lab scientists are the one who did the behind the scene. Yeah.
Okay.
To give us established diagnosis in written report.
Thank you, Puan Suzana. So, you know, Dr. Purani, there's been a lot of discussion early on in your presentation as well about the results of the expression of the mutation, but we haven't spoken a lot about, you know, being a carrier of the mutation itself. And this is something that I think just now Edmund himself mentioned that he didn't know that he was a carrier of the SMA mutation. And the question that's been raised through our participants here is, how do I know if I am a carrier of the SMA mutation? Is there a particular test that can be taken? And also, I'm going to combine this with another question that's been asked: is it possible to diagnose during pregnancy? Go ahead, Doctor.
Yes. So, as I mentioned, that most parents or most people with carrying the gene, we carry a number of faulty genes and we do not show any symptoms usually. So if we have a partner who has the same faulty gene, is a carrier of the same disease, then our child is likely to have the disorder at each pregnancy, about 25% of them. And to know that usually these are diagnosed after you have a child with the disorder itself, but saying that if you have a family history of very similar presentations, you're not too sure what the diagnosis is. So you might have had a brother with floppiness who passed away early, and then you have another sibling who was born and then had some chewing problems and then went on to have again breathing problems and still probably very weak and maybe has not passed on, and then you probably would know that you have a disorder, and then you would go to check with a genetic doctor. Okay, so most of us do not know which genes we are carrying and what we are going to pass on. So basically, in our country, most of them are diagnosed. The parents know that they are carriers after they have a child with the disease, and I think Puan Susanna can help to explain that as well. And then there was the other question. The second part of the question is whether you can do it during pregnancy. Yes. So if that is the case, that means you already have a child with the disease, then we do encourage the parents to see the genetic doctor and then the counselors and get appropriate information, and diagnostic measures are possible these days.
I might be able to help answer this question, Dr. Puan.
Yes, thank you.
So for carrier testing, if you have family members diagnosed with SMA or genetic condition, you can get yourself tested for carrier testing, because not everyone is a candidate for genetic testing because mutations are relatively rare in general population. So for carrier testing to be conducted, an index case is necessary as reference to find the mutated gene in the family. So as for family members or for patients who has previously child diagnosed with SMA, so the most important thing is once the parents realize that they are having a child, like usually they accidentally, or they didn't realize they are two months or 3 months into the pregnancy. So the most important thing is to immediately contact your genetic clinic, or where the clinic first you get your diagnosis, so that you can have appointment, a consultation, and ask the genetic team whether for further planning or management. Because from my previous experience, since I was attached in Kuala Lumpur Hospital, we have appointments with parents who previously have child diagnosed with SMA, and we help arrange for prenatal diagnosis. So prenatal diagnosis, as I said before, we need multidisciplinary team. We need to liaise with lab. We need to liaise with maternal fetal medicine specialists to put an appointment and to slot our patients, because time is of essence here when we talk about prenatal diagnosis. Because for a mother to be tested for prenatal diagnosis, the pregnancy for chorionic villus sampling, it needs to be to 12 or 14 weeks of pregnancy. So for amniocentesis, we need like 15 to 20 weeks of pregnancy along the time within the time frame. So time of the essence, immediately contact genetic specialist or genetic clinic so that you can get yourself tested. But the point is, even though you did this prenatal diagnosis, the most important question is, what will you do after you get the result? So it's something we need to ponder upon, especially for parents who's going through this, because it's a process. We need to understand the emotional burden.
So I suppose, Puan Susanna, this is where the counseling is absolutely necessary and important. It's not something you can just swing through, and you actually have to get expert information, knowledge, and most importantly, the kind of advice and guidance from these genetic counselors who can talk about what happens next, right? So
because Mr. Azrul, I need to highlight here, because before you are referring patient to for genetic testing, right? We need to have pre-test genetic counseling and post-test genetic counseling. So pre-test, we need to explain the possibilities of result, the risks, and things that related to our genetic testing. And after that, we need to explain again and refresh and the plan, management options and everything in the post-test genetic counseling session.
Okay.
So it's not a one touch and go and we can wash our hands off, and it's an ongoing process because it's a lifelong condition.
Yeah. So Puan Susanna and Dr. Purani, we have so many questions that are coming fast and furious now. Everybody starts this way, starts slow, and suddenly it's coming a torrent. So Dr. Purani, the next question is for you. What is considered a good standard of care for SMA?
Okay, so that's a big question. So SMA affects all motor functions, all muscles. So you've got breathing problems, you've got swallowing problems, you've got standing, sitting, walking problems as well. So I'll start with a good standard of care practice, even though we may not be able to offer treatment options, would be to keep them in a well manner. So saying that, so we want to make sure that they are eating well, they have got good nutrition, they're able to chew, suck and swallow well without choking. And so sometimes when the patient shows some deterioration, we actually offer to put in a Ralph's tube feeding, or we can support them with gastrostomy feeding. And if they're not well, we expect them to be admitted for a short period of time so that they are able to get antibiotics appropriately for their ventilation, for respiratory problems. So some of them eventually have difficulty breathing. The type 2, type 3 might have snoring and other obstructive airway symptoms, which can be facilitated or helped with some form of machine support. When I say machine support, talking about non-invasive ventilation. And then for the rehabilitation part, talking about movement, sitting up straight, ensuring that you do not have a spine curvature forming, a scoliosis coming up, and then getting you good support, wheelchair movement. Sometimes if they are able to walk, you want to get them some foot orthosis and to help them through the journey of having the disorder itself. So that, and then obviously vaccination. So now we're giving influenza vaccine yearly, and then we encourage all our patients to get the pneumococcal vaccine as well. And I think soon it will be the COVID vaccine as well for all patients. So the good standard of care practice would involve a multidisciplinary team, making sure that the patient lives like normal. You ensure that type 2, type 3, type 4, the quality of life is almost as normal as it can be.
Dr. Purani, we've heard quite a bit about clinical trials. So people have also asked, what would I know whether I'm a good candidate for SMA clinical trial?
So as far as I'm concerned, clinical trials being offered to Malaysia are numbered. So they do offer them. It depends on the center and the group of doctors working on it. So when we are offered clinical trials and we do have patients, we do sign up for clinical trials. But so that you need to be on board and see which center and which hospital is running a clinical trial. And then...
So you would need to get the information from your doctor who would be able to advise you on what clinical trials are available, whether you can participate, what kind of profile, et cetera, right? And
correct.
So it's important to have that communication and discussion.
Yes, and that is why it's good to maintain good standard care practices as well. That means you are well, and then you are able to participate in these trials, and then and that's a long process as well. That's a very complicated, very complex process as well. So there's a lot of multi-level issues that come up, patients, consent, the clinical trial protocol itself and how it's done or managed. And then you have issues with the drug that you want to bring in, and a lot of policies between the ethical board, Malaysian ethical board, and the ministry and all that. So it's a very big issue and very tedious. Yeah.
So there's a lot of interest in that. So I wanted to have you to answer that. So I have the next question for Puan Suzana, and then we also have a later question for Edmund, which I'll ask him to answer shortly. Puan Suzana, what would you advise parents who have a SMA child and planning to have another child?
Okay, thank you for that question. For parents who are planning to have another child, it's advisable for them to go through prenatal diagnosis if they agree on it. And like I said before, it's nice to plan ahead. It's just oftentimes it happens like suddenly, or you just realize you're 2 or 3 months in your pregnancy. So immediately call genetic clinic where you first diagnose. First, you get your diagnosis and make an appointment and arrangement for consultation first, because for prenatal diagnosis to be conducted, we need time is of the essence. So if you have that plan ahead, then it's good. But if it suddenly happened, like you just realize you are 2 or 3 months in your pregnancy, then you might need to immediately contact your nearest genetic clinic, or the clinic where you first get yourself diagnosed before. Why? Because if you plan ahead, you have already you have the plan and management in place. But if it happens suddenly, then you still have options immediately to go through that, because it's not easy to talk about the plan and because first you might, it's advisable to do prenatal diagnosis first, and the bigger question is what's next once you get the diagnosis. If it's negative, then maybe you can carry the pregnancy to term. But if it's affected, whether you want to terminate the pregnancy or you have other options and your plan, so that's the bigger question. So
okay.
Yeah.
Thank you, Puan Suzana. And it's important to have that conversation with the doctor to ensure that you have all information that's available, and definitely would want to make sure that a good decision is being made. Thank you for that. And I know a lot of people are wanting to know the answer to that. And Edmund, if you could switch on your video, we have a question for you. Did anyone in your family or Sukyi's family have SMA previously?
Okay. I guess we're not sure because, and the reason why I answer that we're not sure is, if you think about your extended family, firstly, there might be the same generation or generations before. So you think of the generations before, and on my mom's side, we've got a big family. On Sukyi's side also, there's big families. We do hear of not many, but children who were born in the older generation who had passed on very early, right? At that point in time, I think no one knew what it was. I have reason to suspect maybe one case seems like it, but there's just not enough facts to figure out, right? So you don't really know. But when Sukyi and I were planning to have kids, we were one of these kiasu parents, to be honest. We were quite happy to test anything and everything. We wanted to eliminate all risk. I wish this was there because this is not one of those compulsory tests. These are one of the tests you have to choose. And I didn't know about it, so we didn't know about it. We had no clue whether we should test, and we had no indication then, as a young parent back then, about thinking about things like this, right, based on extended family. And the other thing is, Brandon's got an older brother. So we've got an older son. So Jaden didn't have any symptoms. Now it doesn't mean that he's not a carrier. I just don't know. Now I have not gone to take him for a test. I think that I want to leave it to him when he's of age to decide for himself. So don't know, right? So it's really hard unless you've got a very clear case that has come up, that then you can make the choice. So that's why I think general awareness is important. And like Dr. Purani said, right, all of us have other mutations in our genes that you don't know about. you don't know because you just don't know, right? And you can't tell from your extended family members, you don't suspect. So the greater awareness would be helpful. But if you ask me for whether there was some indicative signs that clearly came up, no. But I think on the other question would be that now that there is on my side, what would be the response from, siblings and relatives as well? And I would ask that question to Dr. Purani and Susanna as well, that some of the families that they know of, that there's clearly a case, what's been their experience about siblings and extended family from then on? Because then this question has that leg, right? Which is, now that you know, what happens typically? I don't really know. And I don't know whether there's anything to learn in terms of building greater awareness, of giving more informed choice to those extended families who then discover that they do have a possible, or they're in a higher risk profile of SMA. I hope that answered the question.
Okay, well, definitely, Edmund, we really appreciate that you're able to share with us your family's experience on this. And definitely a lot of other families are also wanting to hear from you. And thank you for being able to do that. Dr. Purani, Puan Susanna, would you like to respond to anything that Edmund mentioned just now?
You're on mute, I think.
You mute, Dr. Purani?
No, I'm saying that I think Puan Susanna will be the best to explain on that regarding extended family. What's next?
Go ahead.
Yeah. For what Mr. Edmund shared before, whether extended family can get themselves tested for carrier testing. Like I said before, we need index case. Index case is necessary because mutation is relatively rare in population, and we need an index case as a referral to see where the mutations are in the gene. So if one of the family members, like siblings, nieces and nephews, get themselves tested for SMA, then the siblings, like say touch wood, like Mr. Edmund's son diagnosed with SMA. So Mr. Edmund's siblings can get themselves tested for carrier testing, and Miss Sui's siblings can get themselves also tested for carrier testing to see where the mutation is in the family. So yeah, generally speaking, it's they can get themselves tested once they find an index case in the family.
Okay, thank you, Puan Susanna, and we'll continue on with the discussion. And one of the questions that we have here, and this is a very interesting one for Dr. Purani. Most of the discussions that we've been having have very much been relating back to children, infants, basically pediatric cases, right? So the question is whether you've seen adult cases being referred, especially for SMA types 3 and above, and whether there's been any proper diagnosis for those who are in adulthood with SMA.
So basically, I've been dealing with children throughout my career. So I have children who present a bit later once they're a bit older, teenagehood at 16, 17, 18. So once we make the diagnosis, we pass them on to our adult colleagues to further manage them appropriately. So I don't really pick up adults with SMA.
Okay, well, it's a fair question, and definitely, hopefully, we'll be able to get someone also to be able to share that, because there is a diversity of experiences when it comes to SMA, and we definitely need to be able to share as much as possible in wanting to know what kind of treatment options, but also quality of life that is possible, because there's so many inspiring stories. Every time I meet Brendan a few years back, when I saw him, was full of energy, very vibrant, very talkative, wanting to point here and there, right? So there is obviously a quality of life that is possible. And we know here, and Puan Susanna has emphasized quite rightly, that guidance and support from genetic counseling is going to be very important for any SMA patient, SMA parent. But I would like to bring up a little bit of a tricky question here. We've talked about availability of testing and counseling. We come to the issue of cost. is it available in government healthcare facilities? Is it only available in private? What kind of options are there when it comes to dealing with the cost of testing and counseling? Puan Susanna.
That's an excellent question. From my experience, my previous experience in healthcare, for SMA, we do have PCR, molecular testing. Institute of Medical Research will do the test lab, and they can provide the diagnosis. They can see the results for PCR. So they do have the test, but I'm not quite sure of the cost. But usually for government, I think I don't dare to talk about financial costs for, usually it's with some small amount of money, I'm not sure. So, but for sometimes when there is a need, like time is of essence, right? Sometimes we might need to refer the case to private lab. So it will involve cost and certain things that needs to be done. So the cost, it depends on the lab themselves who did the test, because they have to prepare panel and stuff, and the thing of the medical equipment and facilities is not cheap. So with certain expertise, and they come with cost, like if it's from private, because we have quite a number of private labs out there who are willing to support and provide genetic lab results to our patients. Yeah.
So there are quite a few options that are available out there when it comes to testing. In fact, I think so he's just shared on the chat that there is the possibility of WeCare Journey subsidizing prenatal testing, and there is, when we talk about cost, it involving more than just testing, but also medical equipment that's involved, telephysiotherapy and so forth. So there's quite a lot of anticipated expenditure there, but it is able to be managed, and people can get the kind of counseling that's possible, and it's not an impossible task, and it's important for people to ask questions, right, Puan, to be able to seek these kind of options, but most importantly, get the necessary help that they need. Dr. Purani, there is a question here from someone who is concerned that perhaps there is the possibility of misdiagnosis, between SMA and maybe motor neuron disease or ALS. If a person who is not able to be skilled enough to look at the different symptoms, is there a possibility of misdiagnosis if a patient were to be brought forward?
Yes, so spinal muscular atrophy itself is a very heterogeneous condition. A number of other conditions can mimic spinal muscular atrophy. So there are a number of tests that we do before genetic testing plays a major role, I would say. I think for ALS, which is Lou Gehrig's disease, there's no one test that diagnoses that. But for the SMN, we can do a nerve conduction test, and we examine the patients, and then we also notice that the SMN proteins would be diagnostic usually. And then if there's a further genetic testing, if these were negative, there are other non-5q SMA lookalikes. So it's in the hand of the neurologist or the medical staff diagnosing and looking after the person. I think we don't see ALS that commonly in younger children, but it's a common disease more common in adult population.
So a quick refresher. Somebody's just asked, could you just, if possible, go over the symptoms of SMA and briefly the treatment again? If you could just, Yeah,
so briefly saying, type 1 SMA present as the most severest form of SMA. They have weakness. They're floppy, they're weak, they're muscle weakness. They have breathing difficulties presenting very early and going on to have choking and swallowing issues. You would also notice that this child has delayed milestone development, motor milestone development. So when you're looking at a child at 1 month, they're starting to smile, they're starting to fix, they're starting to follow. So because SMA does not affect the brain, so their intellect is, these children are very alert. They will smile, coo at you, but you will notice that their motor movement, the ones on their limbs, on their chest, on their abdomen, look a little bit different from other children. So you would see that the hands would be moving, but the legs are quite floppy. People would describe it as a frog-like position. You know, it's just flopped down. You can't lift it. The child can't lift it on its own. And then you would notice that they can't turn, they can't roll over. And that's when parents usually come to medical attention saying that my child, I seem to notice that my child's legs are weak, or, you know, I see this movement in the tongue, is something wrong. And that's when we actually pick it up and we diagnose them. So obviously they don't have reflexes in the knee and the ankle. And then previously we used to do nerve conduction test always. But now we've moved on to do just the SMN MLPA analysis for looking for loss in SMN1 protein function.
Is there a possibility of SMA being misdiagnosed as something else? I mean, what's the likelihood of that happening? Or do we now able to eliminate that possibility through some of the diagnostic approaches that you mentioned just now?
Yeah, no, so when we look for the 5q SMA, the common types of SMA, which is about 90 to 95% of SMAs, we are able to accurately diagnose these patients. And there would be the mimics, like I mentioned, the remaining 5 to 7%. And they would need further genetic testing, or, you know, like a sequential analysis, or they might find gene mutations in other genes. So they look like SMA, but they're called the non-5q SMA patients. Yeah.
Okay.
So you need further workup and diagnosis, basically, Mr. Azrul. You need to go and we need to refer them on to the genetic colleagues, and then there's a further test done, either whole exome sequencing or next generation sequencing methods, and then they make the diagnosis, or we follow them up. So during this period, standard of care, good care practices are ensured so that the patient is well.
But I think also needing to emphasize that where we are on this issue is very different than where we were 10 years ago even.
Definitely.
You know, and so we definitely can avoid a misdiagnosis through so many of the approaches, simply because you have more follow-up, you have a better understanding of what to look out for, and you can catch it earlier, right? As long as you're able to have that communication with the doctor, who's able to then order up more diagnostic tests to be able to catch some of those criteria that you just mentioned. Puan Susanna, I'm going to ask you I think this is a tricky question. I mean, it's always a tricky question for me, I think. And this is the role of religion when it comes to, managing a child with SMA. I know for some people, it plays a major part in being able to support, cope, but also help. So what's your opinion on this issue, Puan?
Well, it's tricky too to me. It's when it comes to religion, it's a bit tricky. It's not, but the thing is, we can always refer to, for Muslims, they can refer to fatwa, kebangsaan, and it all boils down to what the parents wants to do, because they are the one who's experiencing life challenges. They are the one who's going through the process. They are the one who's going to bear with the struggles, and because we need to take into account the psychosocial impact of the conditions and the treatment. To treat or to have a child with certain diagnosis. So still we can refer to certain, because religion is personal commitment. Yeah. Can you hear me?
We can hear you,
Can
Puan.
you hear
Go ahead.
me?
Yes, we can hear you.
Hello?
We can hear you, Puan. Go ahead, Puan. We can hear you. Oh. Okay, I think we just lost her there.
Yeah, probably her internet.
I think so. I don't know, Dr. Purani, do you have any thoughts on this question?
It's like I think Puan Susanna was trying to say, it's a very personal journey, and we do try to assist each and every patient coming to us with that. And I think the genetic counselors do a fantastic job, the genetic team. So we usually do not go into those aspects. I treat every kid as my own, and we just give what we have at the moment for each and every child. And when they need to discuss these issues, it's a little.
I'm sorry, I got disconnected
Yes.
just now.
She's back.
Yes.
I'm so sorry, I got disconnected just now. My internet connection. I'm sorry, everyone. So yeah, where was I?
Well, basically, you were just sharing your thoughts on
religion.
Religion.
Because let me rephrase it again, because the fatwa or the guidelines and regulations for religion is already there. But again, it's a personal commitment when it comes to religion. Who are we to say anything about someone else's life choices? Because we are here not to judge. Yeah, because we have our own life struggles. We went through a lot. So it's personal experience. So yeah, it's all up to the person and the family to decide whether they want to carry on or otherwise.
Thank you, Puan Susanna. Thank you, Dr. Purani, for those two, I think, heartfelt answers, because there's no easy way to actually answer this issue, isn't it? And I just wanted to, because we're coming to the end of the session here, is that there is a question here concerning the possibility of missed cases, and this one goes to Dr. Purani, perhaps, of children who were unable to be diagnosed early enough that basically they pass away due to respiratory illness, and unfortunately this is as a result of unable to be diagnosing a child before and to take proper measures. So is there likelihood of possibility of that happening, Dr. Purani?
So that is the commonest case scenario for type 1 SMA patients. So the natural disease progression itself is the child loses ability and passes on before the age of 2 years of age. Obviously, there's a plus and minus to that. But early diagnosis is critical, and it's possible. So for type 2, type 3, it's a bit slower, the progress of the disease or the natural cause of the disease. And what we want to see is that they get optimal care throughout the journey with spinal muscular atrophy. So definitely a lot of patients are missed, and we hope that with these awareness projects, people are able to pick up and to go and see their doctors so that diagnosis is made. You're mute.
Thank you for that, Dr. Purani. And, we are going to be asking, I think, questions on what happens next, and certainly when it comes to care. Puan Susanna, I want you to perhaps answer the possibly the last question here is concerning palliative care, of those with SMA. What kind of options are there available, and definitely what kind of way forward can we see for those with SMA and their families?
Come again? Sorry, Mr. Azrul.
What
you were
kind of
talking about
options are there for people with SMA and their families moving forward? And this includes things like palliative care.
what kind of service they can have in the form of support, is it?
Yes.
Okay. It's a rather good question actually, because I myself was not very much involved with SMA patients, but generally speaking, for palliative care, we have palliative care in government hospitals. We have hospice care. We might get support or information regarding genetic support from NGOs. Yeah, but medically speaking, palliative care in hospital government, we have palliative care to have support not only SMA but all kinds of conditions, medical conditions. So yeah, and if you have any questions regarding genetic counseling services or anything related to genetic, you can always send an email to Genetic Counseling Society Malaysia. Follow on Facebook, like and share, and my seniors and the EXCO members or even the president and advisors might be able to help to answer the questions. Yeah.
Well, Puan Suzana, I said it was going to be the last question, but there's a burning question that's on the link right now. I was seeing, and this is on the question of Zolgensma, I think, and its pricing. Is it useful in the treatment of SMA1, and is there a possibility that it can be much more affordable?
Come again?
This is on the treatment Zolgensma, I think is the way it's pronounced.
Okay, maybe Mr. Edmund can answer that.
Yeah, it's not for you, Puan Suzana.
It's not for me.
It's not for you.
I'm a bit wary there.
Yeah.
So thank you, Mr. Edmund.
Edmund, you want to answer this question? I think you're on mute.
Hello?
Go ahead.
Okay. So the question was on Zolgensma pricing, was it?
Yeah.
Yeah.
Okay. I guess when you're looking at drug pricing, it's an area that I've been looking at for quite some time. Being a parent with a child with SMA, when you know the options are available overseas, getting your hands on those options for your child has obstacle after obstacle, right? It's not as easy as you can go out and buy the drug, bring it back to Malaysia. There's so many hurdles in terms of regulatory approvals, etc., etc. So it's not like buying an iPhone overseas, bring it back, right? Getting a drug from overseas, bring it back is a completely different challenge. So I think the question there was around Zolgensma and pricing. And I'd like to sort of expand that, because it's not just about Zolgensma. So Zolgensma is one of the it's not the newest, but the second disease-modifying drug therapy that was approved in the US, right? Before then was another one called Spinraza, and after Zolgensma was another one called Evrysdi. They're all three different therapeutic options for patients with SMA. What I discovered though, from the day that Spinraza was first approved, that was the earliest in 2016. Obviously, I was interested to see how it can work, or how I can get my hands on it for my son. Then I discovered that the drug, because the question was about pricing. Pricing in the States is something called a wholesale acquisition cost, or wholesale acquisition price. That's a price that's applicable in the US. A lot of people, I think, get mixed up that if you see a price in the US, you think that that's a price that eventually gets paid all around the world. Now, I use the word eventually carefully as well, because there's always a price, but whether you pay that price, which is like a recommended retail price. So you think of it as a recommended retail price for something. What people pay eventually in each of the countries goes through a very long, complicated process of negotiation, right? And becomes a price that is eventually paid. That price eventually that's actually paid is not clear to most of us, right? Because it's highly confidential. So I think when you think about whether it's Zolgensma, it's the same for whether it's the other drug therapies, and the same for any other drug, right? Not just SMA. You know, what price do you pay for that drug? It's not clear and it's not certain. Whether the drugs get offered also to me, right, as a parent for my child, is also another thing. Right? Can I, even if it's approved, or even if it's available in Malaysia, and even if there's a price, can I buy it? I think it's also sometimes not clear, right? Because the whole environment of healthcare in getting a drug into like now we call COVID, right, drug in the arm, but you know, a drug to a patient goes through many steps. So I think, to summarize, I think the first message that I want to give everyone is, yes, there is a price that you will always see that's published in the US. Do not automatically assume that that price would be the price that will be paid for in Malaysia. Because if you look at those prices, often you will completely fall off your chairs, right? Because it's a price in a very different healthcare system, right? I guess for Zolgensma, there are other things that I do know, but I'd rather not talk about it here, because I also need to be mindful that these drugs are not approved in Malaysia. So there's a limit in terms of what we should be talking about. But I think the first message is, when you see a price in the States, let's not automatically assume that we'll pay that price here, right? Because it distracts you sometimes, because you think, oh my God, but you know, and then you start thinking about going down a different track, because that's a US price. It's not necessarily a local price. And the local price can be dramatically different, right? And it can be dramatically close, dramatically far off, right? It really depends. It's on a case-by-case sort of basis.
Okay. Thank you so much, Edmund, for that clarification. And don't go away. Stay there. Don't switch off your video. Well, we've come to the end of this session this morning, and it's been really, really good with so many questions. And I want to give a chance for all of you to say a few words and in the last minutes, and also answer some questions that have come in very, very late. And perhaps the first one can go to Dr. Purani, and in your closing remarks, also answer the question of how long does it take to get the genetic test results, and your last thoughts concerning this issue. Go ahead, Doctor.
Once we get a referral for SMA, we actually expedite the genetic testing investigation. We actually give the lab a call, and we actually ask them that we want the results quickly. And this is recently possible because we've actually had some treatment options via compassionate use program for our type 1 SMA patients. So I think we get results between 7 to 10 days nowadays, and it's through a proper referral channel. Otherwise, I think again, diagnosing spinal muscular atrophy early is critical, and it's a commitment between both patient, parent, and the treating physician to ensure optimal or good care, standard care practices are ensured for these children especially.
Thank you, Dr. Purani. Another question for Puan Suzana, and your final remarks as well. And this is with regards to, testing today for thalassemia is now pretty much standard. It's incorporated into the public healthcare system. And because you're part of the genetic counseling framework that we have here, when are we going to see SMA being part of the regular testing of prenatal testing? Go ahead, Puan Suzana.
Okay, that's a very good question actually, but I'm afraid I'm not in a good place to answer that question, because it needs a policy. It needs to be done in a certain kind of way, acceptance and policy makers. So it might need to be discussed higher up there.
Is it a good idea though?
No, well, it's always good to test and to check earlier than, yeah. It's better to check. It's better now, better late than never. But it's okay. It's better to check it earlier lah. But I'm so sorry, I cannot answer that, because I guess it's not my place to say to definitely say it is. But generally speaking, yes, it's a good incorporation of screening. Yes, just there's always if I'm not mistaken, there's an effort to do, but I might overstep my boundary. So it might still be in the process for newborn screening, that kind of thing. But yeah.
Okay.
So yeah.
Thank you, Puan Susanna. Edmund.
Hi. Yeah, I'll go back to what Dr. Purani last said, right? It's about that commitment, and she talked about the parents, the patients, the doctors, the genetic counselors, and beyond the people that we see here, right, with you as well as a healthcare, practitioner. There's other doctors and other people. There's pharma, there's industry, and then you were talking about policymakers and all that. And back to Dr. Purani's point, it is all of us actually, playing a role to determine whether we think, we can do better. And I think we definitely all can, but it needs all of us, right? And I think it goes back to the earlier conversation also with Susanna and Adina, and they're talking about, it starts with just having the interest and the empathy to understand that, if all of us played a small part, even of the roles that we have, we really can move things forward. And, it's not just SMA, right? It's any other disease therapy is. But, the great thing is to see everyone here. For me, it's just incredible. If you talk about, 10 years ago when Banner was first diagnosed, I would be struggling to find one person to talk to. It's really hard. You find one, and then after you'd be like, you sent round and round and round. But, now look, 10 years later, and all of us are having really great conversations to learn from each other. And there's so many more conversations we have. And I'm really encouraged. I'm really encouraged that, this happens. And it boils down to, everyone here and everyone in the audience, right, who showed up to give us, the probing questions, to be part of, all of us coming together to make that difference. So, yeah, so thanks. Thank you very much.
Thank you so much, Edmund, for those remarks. And certainly it puts us very nicely to the ending of today's webinar. I just wanted to quickly share the slide above, which is for those who are wanting to get e-certificate for today's webinar, to please fill in the survey. Feedback matters to improve upon future programs. You can see it there on your screen. Please do fill in the survey to get an e-certificate that will be issued to you for attendance in participating in this webinar today. And if you do have some more questions that you would like to ask and were not able to, you can submit your questions through this email, hello@wecarejourney.org, which can be answered by our panelists here. I'm sure you're all happy to answer those questions. So, ladies and gentlemen,
sorry, Azrul, there's a comment there about the link. I was wondering whether we cannot submit feedback invalid dynamic link.
The link is what was sent. I'm not sure. I think if you could try the QR code. Sometimes the QR code now is very much the thing for us to be able to scan. Maybe the QR code would work.
And we could probably also email back everyone who gave us their emails.
There is a link that's attached to the chat, also for submission of feedback, that you can get an answer. So if you could just refer to your chat box and see whether that one works, and see if that's possible for you to submit your feedback there to get the e-certificate as well. If you could give that a go and see. Okay, so that's it from our end. So we end today's.
Could we, Adlina? I think you suggested maybe taking a photo. I don't know whether we want to take a group photo.
Yes, we'll take the group photo shortly. Okay. If you could, I just want to thank everyone for attending. And while we go about taking the group photo, just want to say thank you very much to everyone here today for attending this session this morning. And do remember to participate in next week's webinar, which will be held on the 14th of August, same time. And if you've already registered previously for this webinar, you will be able to use the same link to access the next webinar next week. So with that, thank you very much from me, Galen Center for Health and Social Policy, and also We Care Journey for attending this morning's webinar. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh, and a very good day ahead.
Thank you,
to all-
Gavin and We Care Journey. Thank you.
And thanks, Asro,
Yeah.
for leading us through this. Thank you.
Sure, thank
you
you.
very much for the opportunity as well. Thank you.